Hello and welcome to Totally Trades. This session is provided to you by New Ventures Maine. New Ventures Maine has been providing in-person Totally Trades conferences for many years in Maine, and for the past 2 years, we have provided virtual sessions. These sessions are intended for people who are interested in exploring non-traditional careers. Totally Trades provides information about careers in trade and technical fields that students of any gender might want to explore. We welcome students of all abilities, backgrounds, regions, religions, and experiences. Non-traditional careers are careers that are predominantly and traditionally filled by one gender. Occupations such as truck driving, engineering, pilots, and architects are considered non-traditional occupations for people who identify as women or non-binary. Careers such as nursing, childcare provider, and elementary teaching are considered non-traditional for people who identify as men. In today's session, we will be focusing on the career field of nursing. Nursing is a non-traditional career for those who identify as men. Nursing encompasses many different job opportunities, which each require varied levels of education. There are CNAs, RNs, LPNs, and medical assistants. Each of these provide a different type of care, but all work directly with patients. Nursing is a growing and important field. There is a high need for CNAs and other nursing professionals in the state of Maine. This is a trend we expect to see continuing into the future. In nursing, the pay varies based on training, education, and experience. However, the pay is good right now for those at all levels of nursing. Additionally, there is a high and continued demand in this field and plenty of room to grow. As I stated earlier, different nursing positions require different levels of education or training. CNAs must be at least 16 years old and have completed up to or beyond 9th grade. Additionally, they must complete a 180-hour CNA training program. Medical assistants must have a high school diploma or GED, some relevant work experience, and have completed an accredited medical assistant program. LPNs must have a high school diploma as well as a degree from an approved practical nursing program. In Maine, it takes students just 9 to 12 months to get their LPN certification. And finally, to become an RN, students must earn at least an associate degree in nursing. However, it is recommended that those who want to become RNs pursue a 4-year bachelor degree in nursing. This gives students more training and experience and therefore more professional mobility. The great news is that there are plenty of programs in Maine to help you reach your nursing goal. The CTE connected to your school may have a CNA program to look into. There are also several CNA programs across the state that are free of cost. If you're interested in one of the other nursing opportunities, a community college near you may have a program that fits your needs. Additionally, many colleges and universities in Maine offer 4-year nursing degrees. Here are some websites to check out if you're interested in taking the next step into the field of nursing. And of course, you can always reach out to a guidance counselor or teacher for their help. Let's hear from a high school student, Dawson Witten. Dawson is a junior in high school and is enrolled in his CTE program to obtain his CNA certificate. He is currently completing clinicals, which are supervised interactions with patients at a nursing home as he builds skills in the workplace. Hi, Dawson. Thank you for joining us.
Thank you.
Okay. Can you talk a little bit about what got you interested in becoming a CNA or a certified nurse's aide?
I started being interested for like a CNA because I have a lot of medical history in my family, and just being able to understand a lot of those concepts was going to be really advantageous for me.
Great. What are your longer term goals after you get your CNA and graduate?
Some of my long-term goals would be like moving on to be a nurse, and then from there, maybe eventually working my way into like administration.
Administration, okay. So you're in your junior year of high school and you're doing some clinicals right now in a nursing home environment. Is that correct?
Yep.
Yeah. What's that experience like for you?
Um, I mean, it's great. I like the work. Every now and then you'll have someone that kind of looks at you funny, but it's something that I enjoy doing, so I'm gonna stick with it.
Yeah. And do you find that there may be some patients there that actually enjoy having, um, you know, uh, um, man come in and a young man come in and work as a CNA?
I do think that. I mean, there's some like elderly men in there that they're constantly like used to just females coming in. So every now and then they'll have a chance to talk to me, and you can just see them light up. Or even sometimes you'll have like an elderly woman who will be like, "Oh my gosh, you're just a different perspective." But and then even like some of the other CNAs will be like, "Oh, you're a little bit taller. Could you like help me grab this?" So I try to be of use everywhere I can.
Yeah. So men are pretty underrepresented in nursing fields right now. Can you talk about how you feel and address any unfair assumptions and or questions about men who are CNAs and nurses?
Um, I would definitely agree that we're underrepresented. Uh, and I knew that when I was getting into the medical field, where I knew that sometimes I'd be the only male in a class or the only male in like a portion of a facility. But even though we're underrepresented, I don't think that we're undervalued. I think that it's very important to have different, like a different person from a different perspective, even that can look at a situation and have a different mindset on it. But I don't think that, oof, stuff. So some different assumptions that I think would be like, oh, you're less human about it. Like you're not as
Of
emotional.
caring, maybe.
Yeah, which I mean, it's obviously false. I mean, I can be
Right.
just caring as anyone else, but I mean, it gets to you sometimes. And you'll have times where someone yells at you to get out of room because you're a guy. But I mean, it's part of the job. I'm sure that a woman that was in an engineering course would face the same thing. So you you just have to like buck up. It's a hard field to be in for anyone. So you're expecting some resistance no matter what. So it's just important to just keep your head down and fight through it.
Right. Yeah, that's great. What advice would you give a young man who's pursuing a career in the nursing field but is unsure if he should based on his gender?
I would tell him, like, don't be discouraged. Obviously, like you are probably going to be the only guy there, but you're very valued. Like you talk to any elderly or like elderly patients or even an experienced nurse that is working, like you are not undervalued. Like they extremely value your help. And then of course, like it's going to be awkward sometimes just because of the nature, but if you are serious about becoming any part of the like care spectrum from anywhere from inpatient to surgery, it's really important that you stick with it because they need you,
Yeah,
especially.
absolutely. Yeah, I love how you've talked about having a different perspective. I think that's really important. Everybody's life experiences, affect how they approach any job, and we need a broad and diverse perspectives for every career area. Anything else you want to share before we wrap up?
Um, I mean, I go to Career Tech Center, great program here. So if you are interested and you're in high school, uh, we have really good guidance counselors that can get you in.
Yeah, great. Well, I really appreciate you joining me today and taking time from your schedule to do this. So thank you very much.
That was my pleasure.
Dawson has good points to make about how we need diversity in the workplace, which is important to employers, customers, and our communities, as well as the high need for employees in the medical field. Let's hear from a nurse now. This video features an interview with Eric Vaughn. Eric is a registered nurse who also works as a program administrator in a hospital. Hi, Eric. Thank you for joining me and for answering a few questions about your career. What interested you in terms of becoming a nurse?
I have always been interested in helping people right out of school. Um, I started out as a CNA at a high school, worked for many years as a CNA, did multiple different jobs within the hospital, from physical therapy aide, CNA work. I did go back to school and I got my basic EMT license. So I worked on the ambulance for a while, just trying to find out where I really wanted to go. I ended up in hemodialysis at the dialysis center here in Presque Isle as a technician. It was on the job training, and it was there that the nurses really saw my interest in learning and really encouraged me to go back to school for my nursing degree. So I did that. I did it nursing at Northern Maine Community College. I actually did it in a 3-year program versus the 2, because I went and did my prerequisites. So then when I got into nursing school, all I had to concentrate was my nursing lectures. And I graduated there. I was a non-traditional student. I went back to school at 28, graduated at 30. 31, and I've been working as a nurse in multiple different departments ever since.
Great, thank you. What are some of the challenges and benefits you think men face as nurses, being unrepresented in the nursing field?
Definitely the challenges for being a male nurse is just the fact that we are male, and that a lot of, especially when you get into the elderly population, a lot of the elderly ladies don't like it when a male comes in and has to undress them or put a Foley catheter in or do some invasive procedure where they're exposed. That's probably the biggest challenge in their benefit wise. There again is that you're a male, so you get a little bit more respect from certain people into the fact that, you know, when people come in intoxicated or inebriated on drugs or things like that, it gives you a little bit more of a room to stand in versus a small female. You know, you get that respect factor, or just a little more authority, I guess is what I'm trying to say. But there again, it also is that downfall, because then you get stuck with those types of patients all of the time.
Yeah, and I would think as well, like the nursing home example, that there are some male patients who probably love the opportunity to have a nurse who's a man.
Yeah. Yep.
Yeah. What advice would you offer to boys and young men who want to pursue nursing but are hesitant due to their gender?
I would just say do it. If you're passionate in healthcare and want to help people, it's not underrepresented anymore. It's not, that stigma is gone. We need more male nurses in the workforce, just like we need more female doctors. You know, it's becoming an equal playing ground now. And I will say my colleagues like it when I am on shift, for the fact that I bring a little more muscle to help with moving patients, or but you know, the stigma is gone. Go for it. You are the only person that's going to set your limits. So,
Yeah. Anything else you want to share before we wrap up?
yes, I would like to share that. You know, most people think when you go into nursing, that's it. You're a nurse. Well, you are a nurse, but I'll tell you, in the 14 years that I have been doing this, I have worked in multiple different departments. My heart has always been in the emergency room. I've always been an emergency room nurse. But that career opens so many doors for you. I've worked in an office setting. I'm back down here at dialysis working now. And if you would have asked me 5 years ago, would I be in management, I would have laughed at you. But now I run 2 departments in the hospital, the education department and the dialysis department. And my diverse background in nursing is what got me to where I am today. So, you know, you're the only one that's going to hold yourself back.
Great. Thank you so much again. I appreciate the information, and I'm sure the young men watching this will as well.
And good luck to everybody.
Eric's stature often causes others to see him as someone authoritative and physically strong, and that is part of his story and affects his perspectives and experiences. However, many men do not have the same physical stature as Eric and therefore may have varied experiences. People often make judgments about what men and women can and cannot do based on physical stature, but the reality is that it is important to employers that they keep everyone safe at work to avoid on the job injuries, and they support working in teams and using proper body mechanics at work in order to do just that. Okay, let's take a look at an example of a possible career path. Say your junior year of high school, you complete a CNA program and an internship at a nursing home. This helps to secure you a part time position as a CNA your senior year. As you continue to work as a CNA for the next 2 years, you also train to become a medical assistant, supported by your employer. With this extra training, you find a job at a medical clinic. While you're working at this clinic, you decide that you want to become an RN. After talking to your employer, you find they're willing to sponsor you and help cover tuition, and you go on to complete your nursing degree and move into working full-time at a hospital. In many cases, nursing is a field that not only has room for growth but encourages it. By working hard at a job you enjoy and developing relationships with your employers and coworkers, you can continue to learn and grow. Do you think nursing might be the right fit for you? Ask yourself the following questions, and if you feel that some of these describe you, nursing could be a path to look into. Your feedback is important to us. Please complete the form that was sent or provided to you by the school staff person who gave you the link for this session. Totally Trades is sponsored by the Maine Department of Transportation and the Maine Department of Education, Career and Technical Education. We thank them for their support. On our website, you can find other partners, organizations, and employers who also support Totally Trades. Thank you for attending today. We hope that this session provided you with useful information and encourages you to continue your career exploration.